He earned his Bachelor of Arts in Social Ecology in 2007 from the University of California, Irvine. Oh, yeah, I went to that school. Located in Irvine, California. So let's give a round of applause to Grant Hirayama. Thank you again for coming. Before you go ahead with your presentation, we're going to do an icebreaker.
Okay.
For the students that are here, make sure if you to sign in, sign out, grab food, grab water. And I'm going to make announcements. Actually, I'll make announcements right now. So on your flyer too, it lists the upcoming events. You should have gotten my emails about the mid-semester retreat and also the invite on GroupMe. But there's also a statement of purpose workshop, reading the textbook, graduate panel, physical therapy admissions talk, and another check-in mentoring session. So make sure to go to those, especially the big mid-semester retreat. As far as, oh, and make sure you get food and water, and there's going to be enough to get more at the end, I believe. So we're still waiting on maybe like 2 more. But let's go around and for our icebreaker, say our name. We'll introduce ourselves every single time at these events. Say your name, and for a check-in, say what kind of exercises you do, whether it be mental, physical, either one, right? So, and then let's do one more check-in. What is one fun thing you're gonna do to de-stress? So let's do those 2 check-ins and say our names. So I can start. I'm Anna Kapinton, and as you know, program coordinator for this year. And for me, for exercise mentally, I've been trying to meditate a lot and get my mind to exercise being free of stress and just letting all those thoughts go. So I've been doing that. And how I do it is I play some meditation music and then dim the lights and try to focus only on that. And trying to practice so that helps me be more present. So there's a lot of tips on being present. So that's how I mentally exercise. One fun thing I'm looking forward to this weekend is I am going to do yoga, but honestly, I'm not looking forward to that this weekend because it's going to be like 12 hours, exhausting, and I've been exhausted all week. So yes and no. I'm excited for it to free my mind because when I'm doing it, like my mind really actually clears up. But physically, no. I don't want to, no. but mentally, it should be fun. It should be good. So let's go this way.
All right. I'm Ken. To exercise physically and mentally, I go to the SRC as much as I can, unless I'm drowning in schoolwork, which lately I've been drowning in schoolwork. But for me, it's not only just physical. I feel like for like an hour and a half or 2 hours, you can just put on music, clear your mind, and really just work out, like focus on your breathing and form and all that stuff. So it's like more than just physical for me. One thing I'm looking forward to, like kind of more towards winter break, I'm going to the Philippines to spend like the holidays with like my parents and my family over there. So kind of just looking forward to that.
Hello, my name is Valerie. With physical activity, I walk to school every day. Other than that, I don't really do a whole lot. I should, but I don't. With mental health, I usually do like music. I like to play music a lot. It helps de-stress a little bit. And something that I would like to do, I would want to start meditating to kind of help, free my mind with all these stressors. And, yeah,
Thank you. Thank you both.
I'm Ivy. For a physical exercise, I walk like 15 minutes back to my home. So I walk back and forth a few times. So I think that would be my exercise. And for mental, I read Bible and try to listen to the music so I can just focus on that. And doing fun stuff. I'm gonna play with children this weekend, so it's gonna be great.
How old?
From 3 to 8.
Okay, thank you. And then the staff as well.
So my name is Emily.
What was it?
So, physical exercise.
Physical or mental?
Okay, so I'm not gonna lie, I have not been exercising at all. But I am currently looking for a kickboxing gym in the area because I love kickboxing and I would like to continue kickboxing. So I think that would be a great stress reliever and also help my mental health. But what I do is I'm a very local person and like to always speak with my friends and I'm really close to my family. So to, kind of de-stress, I vent a lot and I communicate.
Hello everyone, my name is Erin. I go through cyclical like, oh, I'm super active and then I don't do anything and then I'm super active and then I don't do anything.
Me too.
But earlier this month, I was being pretty good about going to hot yoga once a week, jogging, and going to the gym. This week, I've done different things, but just very, very short at home workouts. Like, very short. And
Something fun
also something fun that
you're gonna do this
we're gonna
weekend.
do this weekend. Which is hopefully going to be fun and not stressful.
Oh, that's
Yeah.
exciting.
Yeah.
They made it. They're
Yeah.
making it. They're winning.
Yeah. Well, I mean, yeah, I'm just gonna go to a restaurant to watch it because we don't really have people. So yeah, I'm hoping it'll be fun.
Nice.
Hi everyone, I came to see, just like the others, I mean, I go to the gym, but lately I fell off because of midterm, so last 2 weeks I haven't really gone. On my watch, there's this thing that like pops up and tells you to breathe. That's what I've been doing lately, so like when I'm studying and I'm really stressed out, it'll pop up and say breathe, and then I'll take a break and then come back studying, so. That's what I've been working on, and then something fun over the weekend, it's like a body exhibition.
Ooh.
Oh, cool.
So, yeah, there's time, so.
Are you bringing your teacher?
No.
Thank you.
Cool. I'll jump in too. My name is Grant Hirayama.
Yes.
And let's see, I'd say just going to the gym is kind of my both physical and mental relaxation or exercises, if you will. And for fun, God, I can't even imagine 12 hours of yoga. That's, I'm just tired thinking about that. But I would say for fun, I'm running in that half marathon in LA this weekend.
Oh.
Fun might be debatable. I only got about a mile in, so we'll see what happens. But again, thank you for having me, guys. It's nice to see a familiar face. And just before I get going, where are you guys in terms of your schooling year? Are you guys first year, second year, third year? Are you guys seniors?
I'm a senior.
Senior, okay.
Junior.
Junior.
Graduate senior.
Okay, good. And then in the corner there?
I'm a senior.
Senior. Oh, okay, great, wonderful. And do you all want to go into the healthcare field? PT, all PTs? Oh. All PTs? No. What other profession?
Speech therapy.
Speech therapy. Okay.
Same.
Okay. Well, nice. Well, I've been asked to come and speak with you and kind of hopefully inspire you to pursue a career in healthcare. Sounds like my job's already done, so we'll end there, not to. Hope I can convert and bring some of you guys over to the PT world, okay? But yeah, my name is Grant Hirayama. I'm a physical therapist. I'm a board certified orthopedic clinical specialist. This is kind of my life in a nutshell, or on a PowerPoint slide, if you will. I guess in no specific order. Let's see here. Again, kind of going to the gym, that's kind of like my mental exercise. I'm a huge fan of mixed martial arts. Born and raised in Northridge, California. Let's see here, I'm a UC Irvine alum. And following UC Irvine, I went to Western University where I got my physical therapy degree. I currently work at San Antonio Regional Hospital, a community hospital located in Upland, California. As well as I finished residency over at Casa Colina in Pomona, California. Back there, that's my buddy, partner in crime there. His name's Bandit, the border collie mix. That picture up there, every once in a while, I like to cook. I like to cook. There you go, that's perfect. I like to cook. About 95% of the time, it turns out to be a big disaster, but every once in a while we get it right and it's actually something edible. Huge Lakers fan, despite the last 3 or 4 years. Keeping my fingers crossed for this year, we're looking good so far. And also this year is my very first class that I taught. They actually just graduated last year and they just took their board exam Wednesday this week. So we're keeping our fingers crossed for them. So I'm a 4th generation Japanese American on one side of my family, and on the other side I'm actually 5th generation. Here's a picture of myself and my family. This is Rainbow Falls up in Mammoth, California. My dad, my mom, and then my sister. Growing up, I like to think that I had pretty much a traditional childhood. You know, mom and dad, mom's a teacher, dad's a mechanical electrical engineer. So they'd be off working all throughout the week, and we'd get sent to grandma's house with some sort of babysitter and hang out. Everything was normal up until about 10 years old, and I'll kind of get into that later on in the presentation. Okay? In terms of a little bit about myself and my education and training, as I mentioned before, I originally started at University of California, Irvine, where I pursued a bachelor's in social ecology. In case you're wondering, social ecology is a kind of multidisciplinary approach where it encompasses kind of environmental sciences, criminology, law, and society, as well as psychology and social behavior. So it's kind of one of those build your own degree, kind of select your courses that you found interesting and make sure you fulfill those requirements. After Irvine, I went to Western University of Health Sciences in Pomona, California, where I got my doctorate of physical therapy. And a couple years out of school, I went and pursued residency where I did residency over at Casa Colina, located in Pomona, California. When in school, part of our curriculum, aside from being in class and getting that didactic coursework done, we also have to complete clinical rotations. And so these are the sites that I was sent to and completed my clinical affiliations. I started off here in pediatrics, where I did a 2-weeker. I think that was fun and challenging, but just not quite for me. Okay, I didn't like the kids crying, and some of the cases were a little bit difficult to kind of digest and kind of leave at the clinic. I also did a rotation over at Kaiser Permanente in their outpatient physical therapy department. I also did another one over at the Body Center. That's a private outpatient clinic. This is actually the same clinic where Dr. Fairley owns and comes from. And currently I'm working at San Antonio Regional Hospital, located in Upland, California. Okay, and again, just kind of reiteration of some of my jobs and responsibilities. These are the 2 that I haven't quite mentioned yet. Over at San Antonio Regional Hospital, I work in both outpatient orthopedics as well as the acute care setting. So I see everybody from maybe they're coming in for sepsis, and we might get a referral to get the patient up out of bed and assess their functional ability, to maybe somebody who's endured some sort of sport injury or is coming to clinic with some sort of low back pain. And so the spectrum of patients that I see is pretty broad. When I'm not in the clinic treating, I am also an instructor and clinical faculty member over at Western University of Health Sciences, where I teach students throughout their 2 years, 2 of the 3 years that they're actually there. And I'm also part of the Western University Diabetes Institute. This is kind of a responsibility that we're kind of phasing out just as things are changing over there. An integral part of my responsibilities at Western University, as well as being just a physical therapist in general, is to be an evidence-based practitioner, and making sure that the things that I do in clinic are supported by the research. And in addition to that, making sure that I become a contributor to the current body of literature. This is a presentation that we did 2 weeks ago, where we flew to Columbus, Ohio, and we presented at the Educational Leadership Conference. And we basically, it was a presentation focused upon how to create a simulation lab on the cheap. So a lot of things that we do in school is very much book focused, right? But when you get out into the real world, the amount of time that we spend in the books is quite limited, right? We're kind of interacting with patients on a regular basis, and our job becomes very much practical, right? In which case, one of the great things that some institutions have are these high-tech, fancy, very expensive simulation labs, where students can come in, they work with a simulator or a dummy, and they perform some sort of task and hopefully complete whatever objectives are before them. In many cases, certain institutions can't afford such a high-tech, fancy simulation lab, and so a few years back, I decided to kind of create my own. And so by just taking various pieces of equipment within our own department, kind of makeshifting certain things, recruiting several faculty members, we put on this presentation here for the classes. And this has just been a big hit throughout the following years. Other things that I've been a part of, I've done a lot of research and been a part of research in terms of mentoring, and a focus on how can we help mentor our current students and eventually guide them towards potentially a career in teaching, okay? And that's kind of taken me all around. Also in 2013, I did a study focusing on the effects of kinesiology tape. So if you guys have seen the Olympics or even any like pro sports nowadays, you see all these bright colored pieces of tape on them, right? Well, back when there was not much really known about kinesiology tape, we built a study focusing on what are the effects of taping the calf muscles essentially, and the effects on their athlete's ability to jump, sprint, and ultimately, what did the athlete think the tape was doing to them? We went to our state level conference where we presented this poster here. And then eventually we actually got published into one of our peer-reviewed journals. So that was pretty exciting for us. In terms of continuing education, again, as you guys I'm sure are well aware, the field is always developing, always these new fancy techniques are coming out, right? So we're also it's important to stay current. And so this is kind of a list of some of the things that I've attended. You know, I've done some coursework in taping, obviously, to help build my understanding of some of the research that I've done. I've gone to some Graston technique or instrument-assisted soft tissue technique. So now in the Olympics, right, as of the last round of Olympics, right, we saw all that cupping and bruising strategies that you saw some of these Olympians kind of sporting, I guess you will. And so I've gone coursework in that. More taping, and then I actually just got back last weekend from this new intervention referred to as blood flow restriction rehab, where we'll have patients perform exercises with a tourniquet on that'll limit the amount of blood flow to the extremity. And of the research that I've seen thus far, the findings are quite good in the sense that we can help the muscle to grow, and we can help to employ, or we can help to foster significant muscle gains and strength and muscle performance overall with minimal load by using these tourniquet systems. So rather than having to go to the gym and having to lift an excessive, abundant amount of weight to stimulate muscle growth, rather we can apply these tourniquet cuffs or blood pressure cuffs, decrease the amount of blood flow to that area, have them perform a light load exercise and get similar results. So I thought that was pretty fascinating last week. There's a lot out there. Honestly, the options are endless. So what exactly is physical therapy? And so just by show of hands, who wants to be, who's interested in pursuing PT? Okay, great. You have one. Okay, good. Okay, so here's my question to you, right? When you go to the cardiologist, right, they're gonna go and treat you for what? Your heart, right? Yeah, your heart. There's a heart doctor. When you go to, let's see, how about an oncologist? What is their specialty? Cancer, right? Oncologist is a cancer specialty, right? How about physical therapy? When you go to the physical therapist, what do they do?
Your movements, you rate your emotions.
Oh, see, this is coming from the already soon-to-be PT. I like it. Yeah. Okay. Good. Right. And for the general public, unfortunately, it's not really well known what exactly the physical therapist does and how we contribute to the healthcare system as a whole. Okay. Physical therapists, we're the movement experts. Okay. Physical therapists, we're healthcare professionals that diagnose and treat individuals of all ages, of varying types of medical pathologies. And our focus is to help improve the way they move and ultimately kind of overcome any kind of functional limitations that are affecting that individual's life. Okay? So, for instance, if it's a patient who is coming in with severe low back pain and they're a teacher, and they got to provide an hour lecture 3 times a week. But that back pain is so bad that, they can only stand for about 20 minutes. And then they have to sit down, and it's really kind of affecting the way that they like to teach or their ability to effectively teach their classes. Right? Our job would be to actually go in and assess what kind of functional and movement dysfunctions does that patient or individual exhibit. See if we can potentially employ a treatment that may help decrease their pain, improve their mobility, and return them back to teaching for that hour.
I have a good example.
Sure.
I just took my grandmother to physical therapist for the first time, and I didn't really know what physical therapists did. But she has really bad arthritis in her right knee.
Okay.
And so when I took her to the consultation appointment, exactly what you just said, the physical therapist assessed her movement and then gave both of us, a list of exercises that she could be doing at home to improve her movement and improve her daily life.
Perfect. Absolutely. And you said grandma?
Yeah.
How's grandma doing now?
I mean, she just started
Oh, okay.
last week.
Okay.
So we'll see. I actually have to call her and make sure she's doing okay.
Yes. The most important part. What do you think the challenge is with regard to this? With regard to kind of our focus, especially coming from potentially a patient perspective. Consistency, absolutely, right? Compliance, sure. What else? Any other things that you think are challenging with regard to kind of this broad description that we have here? I'd say one of the biggest challenges is that it's not an automatic fix, right? In many cases, it's not an automatic fix. You go to the doctor, you have some pain, you get prescribed some sort of medication, and that pain decreases, right? In this case here, oftentimes the exercises we prescribe requires time for that patient to learn that new movement pattern, to build whatever strength they need, right? Those are all based off of time and compliance and being consistent with those home exercises. So it's challenging oftentimes for patients to understand that and kind of stick with the plan. And that has to do kind of with our ability to sell the plan and make sure that you guys buy it, right? And more or less car salesman, this is the best treatment plan. I want to make sure that you buy into my treatment plan, and this is how we're going to get you better. So again, what is physical therapy, right? We diagnose and manage movement dysfunction and enhance physical and functional abilities, right? We restore, maintain, and promote physical function, wellness, and fitness, and ultimately quality of life. Okay? This has kind of been the major focus, but current practice is now further kind of shifting its focus towards not only do we want to see people after they're injured, get them better, maintain that better state of health, but we also want to get ahead of injury, right? We want to get ahead and potentially prevent the onset of these types of pathologies that we treat. The physical therapist wears a lot of hats, right? We kind of work everywhere. Acute care, that's again that hospital setting where that patient come in maybe to the emergency department, they get admitted to the hospital. We'll go see those individuals. Home health, they can go to people's houses who need therapy and treat them there in their house. Hospice, the people who are diagnosed with some sort of terminal illness, and we need to go in there. Again, movement is still key. We work in schools, wellness centers, outpatient clinics, and kind of all over the place, which is nice. Especially if you're interested in physical therapy, kind of the options, again, as I mentioned before, are endless. What do we treat? Here's just kind of a broad list of all the pathologies that we could potentially treat. Of course, it's not an all-inclusive list, but arthritis, back pain, balance deficits, burns, okay, fractures. Obviously, we're not really treating fractures. We're not going to fix the fracture or anything like that, but preserving movement in the structures around the fracture, okay, depending on the state of the fracture, right? Stressing that site stimulates bone growth oftentimes, so being able to stress the site safely and effectively. Headaches, incontinence, okay, sports injuries, stroke, TBI. Okay. And again, as I mentioned before, remember our specialty. It's not to decrease the stroke or fix the traumatic brain injury, but rather for these individuals who have any of these types of dysfunctions, helping them return back to their prior level function or something close to their prior level function, getting them back to the highest functional level. So if these individuals had a stroke and they have some sort of left-sided weakness, right, potentially teaching them new ways to get up out of bed, safe ways to transfer, sit to stand, teach them how to use a piece of durable medical equipment like a cane or a walker so that they can ambulate again. And remember, that's our focus. Here are the core values of the physical therapist, okay? These are the virtues that we structure our practice upon. Okay? This image here is just kind of tying in all the themes that I've thrown in thus far. This is a picture of the first time we employed our simulation lab within the lecture hall. These are some of our students here, and this is one of our instructors. Okay, this is our simulation lab, and of course, if you remember him, that's Dr. Jeff Fairley. Okay. In terms of job satisfaction for our potential people who may eventually want to become PTs, and for you just to further confirm this is a great field for you, CNN Money gave physical therapists a grade of A for quality of life indicators, right? Physical therapists have one of the highest job satisfaction levels, okay? In terms of employment looks good, right? We are definitely in demand. 39% growth is predicted throughout the year of 2020. We've been reported to be one of the best jobs in America, one of the fastest growing jobs. Okay. And the benefits of a physical therapist career, right? I'm sure all of you guys, when you get asked, well, why do you want to be a physical therapist? Why do you want to be, what profession do you want to go into?
I'm not really sure right now.
Okay, that's fine. That's good.
Sorry.
Any idea?
Well, I switched to human services.
Okay.
I was thinking maybe behavioral therapy or even above that.
Awesome.
So I'm really like just in limbo right now.
Yeah, that's great. So behavioral therapy, right? And if anybody were to ask you, well, why do you want to pursue that specific career path? Undoubtedly, the answer would be, well, I want to help somebody, right? I want to make a difference. Right? Physical therapy definitely falls into that as it relates to pain and decreasing a patient's pain, right? It also relates to that in the sense of for that individual who hasn't been up out of bed or has had trouble ambulating for X amount of time, right? Being there in those initial phases where they're finally able to get up and going, right? Pretty emotional events, and it's just very rewarding in that sense. To be a movement expert, right? As our field grows, I think that the general public will further understand and better understand what exactly we do and how we can better impact the healthcare profession, right? We have good job security, right? I personally love my job, right? You can choose your location. You guys saw that broad list of, I can do pediatrics, I could go into geriatrics, I can do sports, kind of whatever I'm interested in. And if you're an entrepreneur, you can even start your own practice. kind of where we've been. Years back, the vision was that by 2020, any physical therapist providing care will have a doctorate level degree, right? And the purpose for that was vast, but again, it was mainly to allow our consumers to understand what we do, and that we are equally qualified to provide good quality care. And furthermore, the push has been for direct access. And what that means is that, well, in years past, what you would need to see a physical therapist is you'd have to go to a doctor, you'd have to acquire some sort of referral, and then they can come see us. Now, you can, patients can come directly in, and we can treat them, evaluate them and treat them, should they be safe to treat, that is. Of course, there are limits to that, we won't go into that, but just things to keep in mind. Kind of where we're going, kind of as recent as this last year's state conference, kind of the conference's focus has been to really push and get the public to understand what it is that we do. Right? So you guys are already ahead of the game, right? Again, we want individuals to not think of physical therapists as, oh, I'm going to get a massage. That's not what we do, right? I'm not going to go work out. That's not what we do, right? But rather understanding that movement in itself is a system, right? There's a cardiovascular system. There's a pulmonary system, right? There's also a movement system, and we're pushing for that recognition and for the public and for other healthcare providers to understand that and respect and appreciate that. A little bit about the degree in and of itself. Currently, to my understanding, I believe all programs within California are offering a doctor degree in physical therapy. And in order to practice or become a physical therapist in the US, you need to earn a DPT or DPT degree from an accredited institution. You need to take and pass a licensure exam. The licensure exam happens at the end of your 3 years, obviously after you graduate. It's a 5-hour exam, 250 questions, as well as a law exam. And the law exam has been left off mainly because some states have a law exam and some you can just kind of take it online, so it's variable. But those are the kind of baseline requirements that you will need to become a physical therapist.
Is it required in California?
Yes. Yeah. Yes. And the licensure exam for California is, I believe, an hour, and it's 55 questions. Length of program, typically it's about 3 years. And of course, this is a graduate level program, so an undergraduate degree is required. Time in classroom is approximately about 80% of the time of the program. So 80% of the time our students are in class learning the didactic coursework, so anatomy, kinesiology, orthopedics, etc. And then the last 20%, they're in clinic. And the way that the clinical rotations are spread out, it varies per program. In our program, the students will go out at the very end of their first year. They'll do a 2-weeker. They'll come back for 2 semesters, and then they'll go out for 12 weeks. They'll come back to campus again for 1 semester, and then they'll finish off the program with 6 months in clinic. And on average, programs have about 27.5 weeks in clinic. Our program, I believe, we're nearing 40. So it's just a little bit different. Primary areas in our curriculum. Again, these are kind of the subject matter that we address throughout the 3 years of the students' time with us. Everything from your basic sciences, such as your biology, anatomy, your histology, phys, to pharmacology, neuroscience, even building a practice, okay, finance, and so forth. After you graduate from PT school and you become licensed, there are additional training options that you can pursue. One of them is known as residency. I went to residency. Residency is typically 1 year to 2 years. It depends on the program. And basically, residency is a chance for you to further develop as a clinician, become even more proficient and efficient with what we do. And specifically, you choose a residency in a specialty population. So I chose to pursue a residency in orthopedics. However, should you have an interest in pediatrics or acute care, women's health, those types of residency programs exist as well. Fellowship typically occurs after residency. So after graduate school, after your 1 to 2 years in residency, you can elect to complete a fellowship, which is another 1 to 2 years. And this is a program further focused on a even more specialized patient population. So if you are into performance arts, there are fellowship programs for that. If you're into, if you really like the spine, right, and treating patients with any kind of spine disorders, there are fellowships for that as well. These are all optional. This residency typically occurs first. You do not have to have gone to residency to get into fellowship. However, in order to get to fellowship, you do need to have some sort of specialization in one of the subpopulations, so pediatrics, orthopedics, neurology, so forth. These are the things that you can earn a specialty certification within. These are the kind of focus areas: cardiovascular and pulm, clinical electrophysiology, geriatrics, neuro, ortho, sports, peds, women's health. There is an acute care, or from what I've heard, there's an acute care specialization coming. We just don't know when quite yet, but I hear that is in development. So that's kind of enough about my sales pitch in terms of why is physical therapy great and all that, right? But I'm going to talk a little bit about my path to physical therapy and kind of how I got to where I am. And last year, and this year, I want to talk about dreams, right? And the need to dream big. Here was the dream. I wanted to be this guy, okay? Now, I didn't want to be an actor and star in this TV show or anything like that. I actually wanted to be a crime scene investigator. I went to school at UC Irvine, and one of the focuses in my degree was criminology, law, and society. But, you know, somewhere along the way, I just realized, hey, you know what, I really don't want to see people in that state for the rest of my life. The show, have you guys all seen this show or some sort of variant of this show? Right? These guys are seeing individuals on their worst day, right? And I didn't want to deal with that. You know, it seemed like a kind of stressful job and something that you take home with you all the time. And so I had to put that aside. Throughout PT school, I was also working at a sports bar. This was a picture of our sports bar here, where I started as a host, and I worked my way up all the way to a lead position. And, you know, this seemed to be a great lifestyle too. It was very lucrative, fun lifestyle. However, you know, in terms of when I sat back and started really thinking about life as a whole, you know, I didn't like how my 8-hour day could turn into a 16-hour day, like in a blink of an eye. I didn't like always being at work at nighttime into the wee hours of the morning. You know, one day I wanted to have, or I want to have, a family and be home at night, right? And so I had to go back to the drawing board, right? And if you recall back to that first slide, talking about my childhood, childhood was what I like to think is pretty typical up until about the age of 10. At 10 years old, I was diagnosed with Stickler syndrome. Stickler syndrome is a connective tissue disorder that, for myself, affected my eyes. And we don't know when exactly this happened, but it could have been from just an injury when playing basketball. I got undercut and landed on my head. But basically, the retinas in one of my eye detached. And so I was blind in one eye. And then for several years afterwards, I was kind of had multiple reattachments. So from about the age of 10 to 17, 18, I was kind of in and out of the hospital, in and out of rehabbing from my eye surgeries. Through, I think, this extensive course of medical treatment, right, and having such a great eye surgeon and running into all these great individuals along my path towards recovery, I had desires to pay it back and to pay it forward. I wanted to repay and thank all those who helped me, as well as hopefully make a positive difference in my future patients. And so here's the new dream, right? This is the new dream. There we go. Right? More or less working with Kobe Bryant. We haven't got there quite yet, but maybe one day. In all honesty, I have the best job or jobs, right? Part of the week, I'm in the acute care hospital. I work with individuals who are technically termed as being medically unstable. Other part of the week, I will go to an outpatient clinic, so kind of like the clinic that sounds like your grandma went to, right? Patients come in and we care for them 30 minutes to an hour, and then they go home and hopefully do what we ask them to do. And the rest of the week, I get to spend with a group of students where I teach them concepts, any part of the curriculum that I'm responsible for, and hopefully, again, help make certain concepts click for them that perhaps were more challenging. If you're wondering if PT is the right career path for you, these are some of the questions that you might want to ask yourself. Are you interested in the human body? Right? It sounds like our corner for our bodies exhibit. It sounds like PT might be up in your future there, right? Do you want to interact directly with patients? Are you interested in a hands-on career? Are you an effective communicator? Do you have good interpersonal skills? Can you motivate people? And do you excel in science? Okay. These are some additional resources that if you guys are interested in pursuing the field of physical therapy, this is the website of our professional association here, the APTA. You can get a lot of good information in terms of what current things are in discussion. You can get information about our upcoming conferences. This is the website here that you're going to utilize if you want to apply to PT school. It's called PTCAS. And the rest are just things that kind of you can look over on your own time. This one here is this is the website that has all the accredited schools. This is the accreditation commission for certifying, I guess, programs to allow or provide a physical therapy degree. Here's our state board's website. And those are the big ones for you. At the end of the day, dream big, right? Do you have any questions?
Well, thank you.
All right. Thank you guys for having me. Little subliminal messaging there. Any questions for you guys? Yeah.
When did you start your volunteer as an undergrad?
I started volunteering probably around year 2. So while I was working at the sports bar, I was also kind of throwing in about 5 hours a week at a private outpatient clinic. Volunteering, and not community service, volunteering, but and interning was part of the degree that I obtained. And so we had to find a site that we could earn those hours. So the sooner you get going, the better. Yeah.
What do you think is like something that can make you more of a competitive applicant to kind of grad school or PT school?
Yeah, that's good. I mean, you know, of course, you have to have decent grades, right? That's obviously going to be first and foremost. But aside from that, make yourselves as well-rounded as possible. You know, and what I mean by that is volunteer hours, and volunteer hours not in just one setting, but volunteer hours in multiple settings. Right now is the time for you to really see, is this what you want to do first and foremost? And secondly, where in physical therapy do you want to go? Do you want to do pediatrics? Do you want to do orthopedics, neurology, so forth? In addition to that, I mean, have good letters of recommendation. If you can do community service, or if you're passionate about a specific volunteer organization, sure, engage in those types of activities. You know, honestly, anything that you can think of that will be a positive eye catcher, right? And hopefully, again, most of the programs these days, I believe, are offering interviews. And so that's just an opportunity for us to, again, anybody can really look good on paper, but that's our opportunity to get to know you, for you to get to know us. And as much as it is our choice choosing you, you too have to choose us and make sure that you want to be a different institution. Again, multiple ways to show how great you are, on paper as well as in person. Any other questions? Yeah.
I have 2 questions.
Sure.
The first one is, so you went to Western for your DPT. You are still there teaching. Can you share your process for how you decided on going there as a student and what you think kind of makes Western stand out? And the
Sure.
second question is how you work with others in the field, so for example, speech therapists or occupational therapists.
Okay. Let's do that one first, since I'll forget the first one. So when I work in the hospital, that interprofessional relationships are very easy. In the hospital, right, I'm running into doctors, nurses, PAs all the time. And that communication is critical. From an outpatient perspective, when I'm not in the hospital, I'm kind of across the street, that purely interprofessional relationship, I guess you can consider that as a little bit less. However, if I need to, I can just simply call up the physician and clarify any kind of orders that I need clarified. And so does that answer kind of that second question for you?
Can you speak more to like working with an OT and speech therapy?
Sure.
Dynamic?
And the acute care setting, that's kind of where I really work with the speech therapists and the occupational therapists. And a lot of times, remember, these individuals in the acute care setting, they're termed or they're labeled as being kind of medically unstable. And believe it or not, simply getting them to sit at the edge of the bed can be exhausting for these individuals who've been in bed for a prolonged amount of time. In which case, with 50 million people coming into the room throughout the day, right, we want to maximize our time. And so it's not uncommon that when I go see a patient in the ICU, I might bring the speech therapist with me so that when attempting to have the patient sit at the edge of the bed or perform any kind of transfer, when they're resting, that speech therapist can get the test that they need to get done as well. And so it's kind of a best of both worlds. We both get our objectives done. We both help the patient. And meanwhile, we can help each other should the patient need some sort of an extra assist, just for improved safety. In terms of the first question that you had mentioned, how I chose Western, is honestly purely luck. When I first applied, it was nearing the back end of the cycle, and Western's application window was still open. It was one of the few that were actually still open. And so I applied. I didn't think much of it. I didn't think I was really going to even get offered an interview. I applied just to 2 schools, Western and Chapman University, which is located in Irvine. And, luckily I got an interview. And so, of course, I was like, hey, why not? I went to the interview. And the one thing about Western that I think still stands true is that interview was a unique experience for me. I had practiced all night, why do you want to be a physical therapist? Why do you want to do this? And why do you want to do this? Your typical expected interview questions. And the questions that I had were very different and not what I was expecting. For example, I could tell that the interviewers took time to get to know me from my application, right? They had asked me about specific things that I wrote about in my essay. And they asked me to kind of elaborate that. And rather than kind of an interrogation, it was definitely more of a conversation that we had. And I thought that was really nice. The student tours that are provided, they all spoke extremely well of the faculty. Just being on campus, it's a different feel. Yeah, it feels like school for sure, but at the same time, it felt very close-knit, especially after coming from a larger institution like UC Irvine, where you're 1 of 400 in the lecture hall to 1 in 50. And I think those are all things that kind of really sold me. In terms of how I transitioned over to the faculty side, once again, did not plan this either. I was in my 3rd year, and I was a student too. Money was tight, loans are running out. So I was like, man, I have a couple months before boards. I got to see if I can kind of get some sort of teaching assistant position. And luckily, I was granted a teaching assistant position. It was the best of all worlds. I was paid, as well as technically I was studying, right? By helping some of these students in their first year, I was reviewing some of the old concepts And luckily, some of those concepts came up on my boards, things that I definitely would not have gone over. So it really worked out. Shortly thereafter, a couple of the instructors that were there, they departed. They left to other institutions, and just when they're in a bind, they asked me to step in and teach one of the courses, and the rest is history. I really didn't plan to become an instructor. My mom always told me I was going to be a teacher. You should be a teacher, you should be a teacher. I was like, nah, you don't know what you're talking about, Ma. But apparently mom knew the whole time. Any other questions? Yeah.
What were some of your challenges that you faced going through school, like the actual program? Or did it come easy to you?
You know, admittedly, in undergrad, I had a rough time, and I say that in all honesty, in the sense that I had a good time in undergrad, probably too good of a time in undergrad, and so again, my hopes for grad school were kind of rocky. You know, I didn't dedicate my time where I needed to dedicate my time in undergrad, and undergrad was way more stressful than I think it should have been, and a lot of that was my own doing. You know, it's first time away from home. I was young. You know, I had one of my best friends from high school was there, so we had a good time, right? We were having a good time. So again, with all that unnecessary stress, when I finally got into grad school, I knew this is not okay. I got to really lock in and focus on what I need to get done. So grad school, I feel, was easier compared to undergrad. And that being said, I can't speak for myself or some of it from myself, but in terms of my observations, I would say the biggest challenges for grad school is understanding that it's grad school. What I mean by that is an undergrad, I don't know about you guys, but I remember, oh my God, the test is Friday. Okay, I'll start Thursday, and then I'm good for Friday, right? And then as soon as I turn that test in, I don't know it's all out the window, right? I completely forgot what I had studied the last 12 hours, right? Grad school is different. Grad school, everything counts, especially if you think of the bigger picture, right? You're not learning just kinesiology, you're learning how to treat your patients for the future. And so everything really builds upon one another. Your second year orthopedics courses are all based off of your foundational kinesiology courses. And so if you didn't do well or you didn't focus on kinesiology, you're really setting yourself up for a hard time in orthopedics. And so understanding that as a graduate student, that's challenging. Being able to adapt, understanding that it's okay to fail. Just what's more important is how are you going to respond to that failure, right? A lot of our students, they don't realize they're the best of the best. We get thousands of applicants a year. We accept 54 to be exact, right? So that puts these students in the top 5% tier, right? In which case they are the best of the best. They're not used to having maybe B's or even C's, and oftentimes that hits them pretty hard. And so kind of getting them in the right mind frame. When you're in grad school, grades matter, but they don't matter as they do here at undergraduate, right? You're not trying to get into another program after grad school. But in grad school, it's really about how well do you know the information? How can you bring this into the clinical environment? How can you make yourself better for your patients? And of course, with that being said, with the top 5% of students, we have to raise our standards and make sure that we're challenging these students to an appropriate level. In which case, again, when you guys have gotten A's all throughout your undergraduate career, things might be a little bit different. And at that time, we don't think any less of you, but rather focusing on you, oh, he got a B, okay? Or he got a U for this one exam. We're looking at how does he respond the next time. Is he just going to sit there and just kind of sulk and I don't get what's happening kind of thing? Or is he going to be proactive? Is he going to go get tutoring? Is he going to approach the instructor? Is he going to change the way he studies, so forth? So I would say those are kind of the biggest challenges that I see and observe in our kind of undergraduate, or excuse me, in our entry-level students. Any other questions? Yeah.
I was planning on going to Western's welcoming week on Saturday.
Yeah.
Saturday. I couldn't go though because we started GRE prep.
Okay.
Is there anything like crazy that I missed or that, because I know the next date that you can sign up for is like June.
Oh, really?
Yeah.
Oh, okay. A lot of the components that Dr. Armstrong, our chair, discusses were in this presentation. However, there are also a lot of components that are missing. Components that are a little bit more specific to actually getting into the program, such as kind of your financial aid stuff, such as student life, such as kind of more in-depth focus and breakdown of the actual curriculum. And so I would say there's a good amount of material that I would still advise that you go to one of those sessions. Is the next one really June?
I think so.
That's pretty far away. I wonder why. Yeah. Interesting. I would say sign up if you can. And, at this point in time, focus on your GRE, focus on kind of bringing up all other aspects of your application, and attend our preview day, right? And again, I have my cards here today, so if you have or think of any questions that you're interested in, I might not know the answer, but I can get you to somebody who does.
Thank you so much.
Mm-hmm.
And I think we have someone from Western coming.
Yes, we do. We have so on your handout, Ken, you want to check out the November 14th event. That's when we'll have someone from Western U admissions talk about the physical therapy program.
Okay.
Is it Karen?
No, it's not. It's Annie.
Annie, okay. Cool.
Yeah.
Very good.
And
Yeah.
one more question. So I'm a bio major.
Okay.
And it's just I kind of messed up. I took like all my GEs in the beginning. I kind of got stuck with all of my not upper dips, but all my strict sciences, like my physics, my calc, my bio, my chemistry. And my GPA isn't as spectacular as I know like some people I'm competing with. But I am I did start volunteering. I just got off from Select Physical Therapy at it's across the Angel Stadium.
Okay.
That
location?
Yeah, I'm in a fraternity. I know how to work with a group of men. What else am I doing? Hopefully I'll do well in the GRE, and then I'm just trying to pad my application in all the other ways that. So is that still looked down upon if my GPA isn't like a 3.8 or a 3.9?
To let me preface this with the best person is going to be probably the individual who's coming from our admissions team regarding those specific facts. What I would say is, in terms of the 4.0s and all that kind of stuff, we have a bare minimum GPA requirement.
Yeah,
I believe
it's 3.0.
3.0. Okay.
Your cumulative is something else, I think, because you guys look at the cumulative for your whole college career, the prereqs, the GRE, and there's a minimum for the GRE as well.
Okay, so as long as you hit those minimums, you technically, I believe, qualify for an interview. And I could be wrong on this, but that's the way I was thinking too. I was thinking that way too. But other strategies that I believe that they would probably advise is that should you have time in your application process and you're not taking any coursework or your course load is light, retake one of those.
That's the point. I'm retaking the Gen Chems, because just looking back at it, it's not even that the classes are hard or anything. It's just like you, I had too much fun and I didn't put the time where the time needed to be. But I'm trying to retake a couple of the classes I got season, especially chemistry, because it's a 5-unit class. Right. So getting an A in 2 5-unit classes boosts up my GPA.
Oh yeah, absolutely.
But yeah, it's just that's the only thing that kind of gives me anxiety, I guess. Just knowing that I'm competing with all these kinese majors or health science majors. But no knock, I'm definitely not knocking the major. And I was a health science major myself before I switched. And then I switched to bio because I wanted to pursue obviously medicine. And then I did more research just like you with CSI or whatever it was. I started to realize that this isn't the kind of lifestyle that I want. I do want to have a family myself and be able to come home and not have all the work burden with me. Right. So and then I obviously what I want to do is I want to help people. So I feel like physical therapy is the best way that I can exert that kind of way to help people.
I'm with you, my man. I agree for sure. Again, it's what you're doing, I think, sounds like it's the right thing in the sense that you've identified a class that you may have had a less than ideal grade, and you're following up with trying to do better in those courses. And that trajectory, that positive trend is definitely going to look well upon you.
And I would just add on to that, just come out to as many Allied Health Academy events as possible so we can get to know you better and you can get to gain more tips on how to prepare your application.
Yeah, it's just hard because like I've been so busy. Like most of the times are like 11:30 till 30. You know, I have class like Monday to Thursday. But if I'm not at class, I'm working. And if not, like Friday mornings I'm at my internship. Friday nights I still work. Saturdays I start GRE preps in the morning. Saturday nights I work. Sundays I have a meeting for Pike, and it's just like, so like I have to like leave my internship early, come here.
Gotta make time for your future, my man.
Yeah, so I get 24 hours in the day, 7 days a week, just trying to spread it out.
Any other questions?
I'm sorry, I was gonna ask another question
Yeah, sure,
that I thought of. So all of the students here clearly go to a public university, right, Cal State Fullerton. How was the transition for you, or what can you see are the pros and cons to going to a private university like WesternU after doing undergrad at a public institution?
For myself, I found it completely beneficial, especially given kind of the amount of focus and the rigor of the coursework. It's nice, rather than being one of 400, 500, or how many are in your typical courses, it's nice just to be 1 to 54, right? And I would break that down even more so. 1 to 54 in terms of lecture. So this is kind of looks like the classroom size that I'd have for a typical lecture, but for my lab skills, I teach the kinesiology course, the first one over at our institution. And while there's a lecture component, there's also a lab component where I'm teaching them, the students, clinical skills. In which case, for the labs, we break them up in half. So rather than 54, I'll have 27 in each lab. And then we also bring in additional instructors. So rather than it's 1 to 27 or 1 to 54, it's actually 3 to 27, so 1 to 9. So it's actually beneficial in that aspect. Again, I mentioned the benefit is I really got to know my instructors, know me more than just, oh, that's Grant, you got to be in my class, that kind of thing, right? It was more so, you know, hey, that's Grant, he likes to go to the gym, he does this, his favorite food is this, and you know what, while he's good at X, Y, and Z, he needs help with A, B, and C. And what's nice about that is, given a smaller institution, I feel that I have time to help kind of specify and customize my teaching approaches to best address each of the individual students and their needs. And it's nice because the students, most of them feel comfortable to approach us and say, hey, you know what, I'm struggling in this. I don't know if I had that really at UC Irvine. Again, my focuses were a little bit off at that point in time in my life, but again, that setting, that size of a classroom is a little bit more intimidating. Drawbacks, I mean, I'm from Western University, is a smaller institution. I remember what it was like to be on campus at UC Irvine. There's always something fun going on. I'm sure that's kind of what it's like here as well, right? There's always something to do. And so I'd say that may be a little bit of a drawback. Western likes to do stuff, but it's not nearly, I would say, as much and as often as what's going on these bigger universities. Western University is only a graduate school, so that's a little bit different. There's no undergraduate students on campus. Everything is all graduate programs. And so for those of you who are interested in other healthcare professions, Western also offers dental, optometry, nursing, physician's assistant, DO, pharmacy, podiatry, biomedical sciences. There's one more. Oh, vet. Any other questions, guys? Oh, yeah. That's the last one? Okay.
Oh, the last one for me.
Well, thank you guys for having me. It's been a pleasure. I have cards up here if you want. You guys feel free to